Now it's time to answer some common medical questions, and joining us is News Channel 5's medical expert, Dr. David Soria. When he's not with us, he is the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you for coming in
You're
today.
welcome. Good to see you.
Great to see you. Sounds like you've avoided the flu, and we've been taking your advice. We've avoided it as well.
I've been lucky again, no question.
Right. Well, here's our first question. Hillary Clinton was in the news recently. Obviously, she's not going to be the Secretary of State anymore, but the big thing was she had a blood clot in her brain. How common is that, and how dangerous is it?
Yeah, well, Mrs. Clinton had what's called a right transverse sinus venous thrombosis. And what that is a big blood clot in the vein that's behind the ear and in between the skull and the brain itself. The causes, well, could be from infection. A hypercoagulable state can do it, like pregnancy, and in her case, head injury. So how often or how common is it? Well, it's not that common at all. 3 people in every million get it, but unlike strokes, it's most common in young children and in women. Matter of fact, 75% of the cases occur in women, which is pretty unusual. So the good news is that because of increased awareness, better treatment, and better imaging, we are finding it earlier, because if it's not found early, it could be very serious. So with that treatment, typically greater than 80% do very well and return back to normal, just like Ms. Clinton's case.
Okay. Second question, should adults get vaccines?
Yeah, I mean, vaccines are not just for children anymore. Matter of fact, there's 2 reasons. One is there's adult diseases that require vaccination, and number 2, your childhood vaccinations wear off over time. So there's a few things that we use to determine what vaccinations people need. Number 1, lifestyle, health condition, age, and then how much do you travel. So to give you some examples, seasonal flu, everybody should get that. Tetanus wears off every 10 years. You should get a booster every 10 years. Shingles, ladies and men over 65 should consider that. Pneumococcal vaccine to prevent pneumonia can be very common. Greater than 65, we recommend that. So those are some perfect examples. Also, hepatitis B, healthcare providers and people over 65. Now, there's a real nice website on cdc.org, and if you get on that, it gives you a lot of answers to some very commonly asked questions. And there's also a form or a questionnaire that you can fill out that'll guide you through what vaccinations you may need as an adult. Bring that form to your doctor, and he or she can discuss with you and let you know what you think, what would be best for you.
All right, Dr. Soria, thank you so much
You're
for
welcome.
coming in. Well, if you have a question for Dr. Soria, you can get it in by going to our website, WPTV.com, and clicking on the health link. Scroll down on the right-hand side, and that's where you'll see the form to write in your questions. Once again, thank you so much for coming in. Of course, we always feel so much smarter, at least I do, after you've been here. All right,
Thank you.
We'll see you next week, and we'll see you after the break.